Hey everybody, how you doing? Uncle Vinny here. Grab a cup of coffee, sit back, relax, and enjoy the show. I'm Dr. Nick Circolone. You're listening to Health Chat. We're talking about trigger points. Now, let me tell you something. Trigger points are one of those things that is so overlooked by a lot of practitioners. When you come into our office and we do trigger points, I'm sorry, Joe. I giggle every time I say trigger points, especially on talk radio, because I think of that Saturday morning show where the guy kept saying the same thing over and over and over again. So if I say things over and over again, just give me like the cut sign and shut up. Don't say nothing because we don't want that. But anyway, so with trigger points, especially in the office, what we do is for headaches, we work on the occipital muscles. We work on the strap muscles or the sternocleidomastoid muscles. We work on all of these muscles, and even we work on the jaw muscles to get rid of these trigger points. Now, every muscle can contain a trigger point. Not all trigger points are painful. Some are, some aren't. But when you get in there and you start working on these trigger points, I will guarantee you one thing. We will bring tears to your eyes, because if we find them and they're painful, they're extremely painful. I had a patient today come in with some trigger points, and we'll talk a little bit about that. And that's what started me on thinking about this. But the trigger points that we're working on, she literally was like holding her breath while I was working on them, but she felt tons better after we were done. Now, if you suffer from really, really intense headaches, trigger point therapy might be right for you. If you're suffering from any musculoskeletal condition that's affecting your motion, it's affecting you because of pain, it's affecting you and just changing your lifestyle, trigger point therapy might be for you. Now, everybody thinks that when they come into the chiropractic office, we're going to snap, crackle, and pop. Not everybody gets that. If you've been listening to the show, we've been talking about that. Not everybody gets that snap, crackle, and pop. Some patients we work on, they don't even hear that popping sound. They get a little disappointed when they don't hear that. They want to like, well, how come I didn't hear anything? Do you feel better? Yes, you feel better. Is your range of motion better? Yes. And you feel better? So why do you want me to crack something just to hear it cracked? It doesn't make any sense to me. So what we're going to be talking about on our shows is I'm trying to give you another avenue to think about as far as chiropractic. Don't always think about the snap, crackle, and pop. Don't always think about, well, when I look on the web, I see these guys doing the towel around the neck, the Y strap, they wrap the head around you, they give you a full Nelson, and then they snap it. That's not what you want. Okay. You want to go where you feel better. And another thing is we don't sign you up, for a contract. I'm not selling you a condo. You're not buying a brand new car. You're coming in, you're getting treatment. We're fixing you, sending you out the door, and you're sending more patients to us. So when we talk about these things, please have an open mind. Now, I'm not saying all chiropractors do that, but what I'm saying is you want to find one that's going to treat you for your problem and not treat you for other things. So when we work on the trigger points, we specifically, there's a palpatory findings. We look for these things. We gently move around the neck and we move around the head to find those trigger points. And when we find the trigger points, we place pressure on them and we hold the pressure. Then we release the pressure. We hold the pressure, then we release the pressure. And what happens is that muscle starts to relax. As that muscle starts to relax, it takes pressure off of the nerves. It takes pressure off of the joints and decreases that pain and improves your range of motion. So that's just for headaches. But let's say you have a shoulder injury or you have shoulder problems where you can't lift your shoulder. Now, I will say this. I had to do trigger point therapy on myself. There's an instrument that I have. It's called the TheraCane. And what it is, it literally looks like a little cane where I can find trigger points in certain areas and push on them and work the trigger points myself. I don't necessarily recommend people going out and buying one until they understand how trigger points work in their bodies, but it is a great adjunct to use. So this week, Joe, what was I doing? Working on the deck, as always, working on that deck. And later on that afternoon, or actually that evening, my shoulder, I was trying to move my shoulder. I was like, oh, that doesn't feel good at all. Because I was leaning on it as I'm screwing in some of the wood. And I had these trigger points in a muscle called the teres minor muscle. It's part of my rotator cuff. And I told my wife, I said, honey, I can't lift my shoulder. She's like, what did you do? I said, I don't know what I did. I was leaning on it, and that was all that happened. So I get out my Theracane and I worked on that teres minor muscle. Let me tell you something. When you work on yourself, you don't necessarily want to increase the pain that you're having. So you're kind of a little bit gentle, but I'm a maniac. So I get in there and I work that trigger point. I worked it for about 5, maybe 10 minutes. After I was done, I was able, wow, I can move that shoulder. I don't have that pain in there. And that's how trigger points work. And what happens is if you do it the correct way, not only does it decrease your pain, it improves your range of motion, and you do so much better. So when you have a shoulder problem or you have a neck problem creating headaches, trigger point therapy may be right for you. Now, I am such a big trigger point guy because when you come into the office, not only are we working on the joints and everything else, but we're also working on all of the trigger points in that area. And that's why when we work on you, it takes a little bit of time. It doesn't happen overnight, but you feel much, much better. And when you leave, it's like, wow, I feel great. But one thing that you have to understand is as we go through this, remember in the back of your minds, you want to use not only ice after we're done, but you want to drink plenty of water, because if you don't drink plenty of water, what happens is that lactic acid builds up in the body and it starts to make people feel sick. Sometimes when we're doing the adjustments, the trigger points, some people get sick to their stomach because it's so painful. But afterwards, that lactic acid that gets in the body and fills up into the system needs to be flushed out. So you need to drink plenty of water when you have that done. Joe, have you ever had trigger points done on you? Yeah. Does it hurt? Oh, see, you've never had it done. So you don't know. Yeah. So but nobody's ever rub your shoulders and go, oh man, that really hurts when you touch it there. That's a trigger point. It's like, stop touching me there. Stop touching me. It hurts. These are the things that we don't want to have done, but if we don't get them done, it creates more problems later on. Now, if we injure the muscle, we're still talking about trigger points, but what happens is as those muscles get injured, as those muscles get irritated, what happens is the body lays down a matrix of fibrous type tissue, not elastic tissue. We need that elastic tissue so we can have that motion. And what happens is when we lose the elasticity in the muscles, now we lose that range of motion. And then we have to get in there with a little bit more aggressiveness, work those muscles with instruments. If you've ever been to PT or for another chiropractor and they pull out these metal instruments and you're like, what are you going to do with them? And they're going to get in those muscles. They're going to scrape those muscles. So if you get the trigger point therapy prior to that, you're going to feel much better. See, a lot of sports athletes get a lot of this trigger point stuff done before they go out onto the field or after they come back from the field to decrease that muscle spasm, to decrease that tension, allow the muscles to become more elastic and allow the nutrients to go in there to help feed that area. So that way we don't have tons and tons of problems as time goes on. Years ago, chiropractic and physical therapy weren't so widely used in sports, but now we understand that just a small injury to a muscle can lead to long-term problems. So we want to deal with them right away. And that's why there's trainers on teams. That's why there's chiropractors on teams. That's why there's massage therapists on teams. So that way we can get those muscles functioning properly. So that way we don't develop problems later on. Unfortunately, when patients come into the office, we see a lot of them with severe pain, decrease in range of motion because they let something go for a long period of time. And when you let something go for a long period of time, what happens is it takes that much longer to get fixed. So if you're starting to have pain in your shoulder, pain in your neck, start having carpal tunnel type pain, what we can do is we can get in there, work those muscles, decrease that tension. But also we want to make sure that we're not getting in there and causing more problems, because what we want to do is not increase the problem. We want to decrease the problem. So as we get in there and we work these muscles and we get in there and we irritate them to decrease all of that lactic acid, you feel better. But you have to understand, after we do all of this, what's the most important thing we need to do is we need to stretch. We need to do some exercise. So part of our treatment plan when we work on any patient is we don't give you a sheet of exercises. We give you exercises in a video format, downloads it onto your phone, downloads it onto your computer or wherever you get your emails, and you're able to see the videos. It explains exactly what we're doing, why we're doing it, things to avoid, and things that you can do to help this area. So when we work on these trigger points, and I keep saying trigger points, because I want you guys to get this in your head, that the trigger points are a key to actually healing your body and getting you back to normal function, because that's what we do in the office is we get you back to normal function. If you've had pain in different areas of your body, you've gotten treatment for them and they feel the same, you may want to try some trigger point therapy. Now, I will say this, there's a technique called dry needling. Now, dry needling came about, and I'm going to get back to trigger point therapy because this kind of coincides with it. What dry needling is we put a needle into that trigger point and we lyse that area. And what happens is it breaks up that lactic acid and helps relieve the tension in the muscle. Well, a lot of people don't want a needle to be put in there. Some people get injections in that area of lidocaine, and sometimes a little bit of cortisone gets put in there to help decrease and the tension there. But years ago, Joe, we found, and I'm talking years and years ago, like in the 1930s, where they were sticking needles and chemicals into these trigger points to see what they would do and how they would react. And they found that whatever chemical they used, something would happen. They would get a release of that area. Now, later on, there might be more problems that were caused by this. But when they put that needle in, they realized that maybe I don't need to put anything in that needle. I can just put the needle in there and do the same thing. So that's how your dry needling came about. But what's more important about that is we can use trigger point therapy, thumb, finger, tool, anything to do the same job to decrease that lactic acid, or disperse that lactic acid and allow that trigger point to relax, allow that muscle to relax. So picture in your mind's eye, you take a rubber band and you keep twisting it, keep twisting it, keep twisting it, keep twisting it, and keep twisting it. And I keep twisting it. And I'm going to say something I shouldn't say because it's going to come out funny. But as you keep twisting that muscle, that's exactly what that trigger point is. It twists that muscle and causes tension and pulls that muscle tight. So what happens is you get this tension in there. And by pushing on that trigger point, what happens is we release that tension. We open up that area and we take away the pain and we improve the function. So like I asked you before and you were like, I don't know what you're talking about. When I asked you if you've ever had a trigger point, you said no. But you've had people touch your shoulders and it's like, wow, that hurts right there. That's a bump or it's a lump. Yeah. That's what those trigger points are. And what happens is if we work on those and decrease that tension, we get the muscles functioning better and we get the joints functioning better and people feel better. Now, as I said, we can use that on any area of the body. We can use it in the shoulder, in the neck, in the elbow, in the wrist, in the hip, in the knee, in the foot, and today I had somebody with some plantar fasciitis. Everybody knows what plantar fasciitis is. Some people go, I feel great if I'm not walking. Well, yeah, because you're not standing on that plantar surface. Or they have a heel spur and it's causing problems. But really what happens is that Achilles tendon gets inflamed and gets irritated and starts pulling on that spur, causing pain when you step on it. So if we work on the muscles, the soleus muscle and the gastrocnemius muscle, those are the big muscles in the calf. What happens is we decrease that tension on that Achilles tendon and we relax the muscles and we relax that area and we decrease the inflammation. So patients, they start feeling better and their plantar fasciitis starts to go away. Now we can literally work on the plantar surface of the foot. I don't know, Joe, are you one of those people that don't like their feet touched? Because there's a lot of people that don't like them touched.
I don't have much of a problem with it, but I prefer you not to
touch it.
Yeah.
So a lot of people when you touch their feet, they're like, please don't do that. But when you get in there, it's very painful because there's tons of trigger points. Think about this. We stand on our feet all day long. We're standing on them. We're putting all of the pressure on them. So we develop, this fascia that gets inflamed and irritated. And of course, now we start getting these trigger points. So we have to work on the trigger points from the heel, from the bottom of the foot, all the way up into the gastroc and in the soleus. And sometimes we have to even go up into the bigger thigh muscles to decrease some of that tension there. It's like these giant kinetic chains that we work on, they cause pain. So it's like, okay, I have pain in my foot, but I also have a problem in my low back and in my hip or in my knee. So how do we work on that? How do we fix that? How do we get things doing? And trigger point therapy is one of those things which works really, really well in decreasing that pressure and that tension.
How many trigger points are there in the body?
Well, everybody that varies. There's not one, like we have, over 200 muscles in the body, but that doesn't mean we have over 200 trigger points. You can have multiple trigger points in muscles, which will cause that pain, cause that irritation, and cause that problem.
So it varies from person to person?
Oh, absolutely. Absolutely. Technically, there's trigger points in most muscles, but we don't know that they're there until they start to flare up, until somebody finds them, until we realize, hey, this is a pressure point, and we call it pressure points. Okay. That's how people realize it. But trigger points are just pressure points that we work on. So we have pressure points all over the body. Now, let's step back a second, because you did ask the question, how many, trigger points do we have? Well, there are specific trigger points in the body that we specifically know where they are. So have you ever done martial arts, Joe?
I watched a couple movies.
Okay, yeah.
Well,
so you've seen the Steven Seagal movies where he just grabs you in one spot and you like go to the ground.
Right.
Those are trigger points, and we use those in self-defense. But that's not the same thing as, excuse me, those trigger points are not the same thing as the trigger points that we're talking about. Those are pressure points that we work on to immobilize a victim, not to cause pain in somebody who's hurting, but they're similar. Does that make sense?
Yes, please teach me how to do that.
Yeah. It's like, yo sensei. No, but yeah, it's a funny story about that. We were at church one day, and I'm just wrestling with the kids. I just will love working with youth. And one of the kids I did that to. I mean, I grabbed him and I just caught him just right, because I knew exactly where to go. And he's like, "Oh God, stop." And so we're doing it another time with a couple other kids. And then one kid's going, "Don't let him touch you. Don't let him touch you. Don't let him touch you." Because we can inflict a lot of pain if you hit those trigger points just right. So, but that's not what we're doing. These are trigger points, but they're not pressure points like you would think that we would use to like immobilize somebody, but they are pressure points. But there are specific pressure points in the body where you can definitely cause pain and injury and cause other problems the way you hit them. So we want to be careful of that too, Joe, because you've heard of reflexology. There is something to that. So you want to be careful about areas that you touch and how you touch them and how long you hold pressure in those areas. Too much pressure, not good. Too little pressure, not good. You have to have that right amount of pressure. And the patients tell you what that is. That's what the cool part is. They tell you what that pressure is. It's like, that's too much. So you back off on a little bit and you work it. It's a slow process. And as you work on these processes or these trigger points, the process of it really relieves the tension and really makes them feel a lot better after you do it. So that's why we do trigger point therapy in the office pretty much on every single patient that comes in, because those trigger points help facilitate what we're doing. Give you a good example. Have a patient come into the office and they have neck pain. Well, during my exam, if we take away the active motion and I passively move the neck, I realize, hey, this neck moves in really good direction and fluid. But as soon as the patient starts to do it, now it becomes more difficult. It becomes hard. They can't turn in certain ways because of the pain. So let me ask you this question, Joe. I know you're not a doctor, but if your neck is moving normally by passive motion, but not moving actively, should I be messing with the joints? Think about that.
I would say yes.
Okay. Most people would say yes, but the answer to that question is actually no.
Okay.
The joints are moving perfectly. It's the muscles that are causing the problem. So what we have to do is we have to work on the muscle problem. That way that the patient's range of motion will improve, not because the neck was locked up, but because the muscles were so tight so they couldn't move it. Does that make sense?
That makes a lot of sense. Yeah.
So when I reach around, and I have a lot of patients come into the office and go, don't touch my neck. I don't want my neck touched. I don't want you to touch my neck, because we had a show a couple of weeks ago talking about, a possibility of a stroke. Well, it's rare, but it does happen. So, but what I'm saying is, if the range of motion is there passively, we want to get the range of motion there actively so it doesn't hurt. Because the reason why you're not moving it's because it hurts. So what we do is we get in there and we work those trigger points. And that's the point I'm trying to make. We get in there, and if we work these trigger points, the range of motion improves. And, if you're suffering from any kind of problem, and here's the thing, and I wanted to kind of bring this around and kind of land the plane a little bit, is you definitely, if you've never been to a chiropractor before, if you're afraid of chiropractic, because some people are, Joe, I mean, they've either they've watched too much stuff, they've had a bad experience with a friend. If you've had that, really, you need to give us a call, because if we can do trigger point therapy on an area, we don't necessarily have to move every joint in your body. And I think that's important for patients to know. It's not every time that we do something are you going to hear that cracking sound. That's not what this is about. Our job is to get you better, no matter what it takes to do that, whether it be in my office or whether we have to send you out. But trigger point therapy is such a non-invasive, easy technique to do, and it has such great results. So like I said, chiropractic is not necessarily snap, crackle, and pop. We're not the three guys from what's that cereal, Joe? I just forgot the name
Rice
of it.
Krispies.
Rice Krispies. Yeah, that's it. It's not necessarily like that. So if you're having these problems and you're thinking about, hey, I want to do this, number one, there's no medicine involved. Number two, there's no surgery involved. It's something you should try prior to doing any of these other things. And please, if you've been listening to the show, you know that I'm not anti-medicine. I'm not anti-surgery. I'm just, hey, let's do something instead of surgery or medications and see if that works before we start putting stuff in our bodies that we don't really need, but people want it. It's easier to take a pill, Joe. It just is for a lot of people. And
people look for that too.
Yeah, well, that's true. And I'm not saying that it's a wrong thing, but if you're taking painkillers and things like that, that's a problem. I'll give you a really quick little take that I don't understand, but athletes themselves, they'll take ibuprofen before they run. Let's just say a runner, before they run, or before they play a sport, to decrease the inflammation. That seems counterproductive to me. Okay. I mean, I want to play a sport, but if I have to take medicine to play a sport, I need to find another alternative that I don't have to take something that may mess me up later on if over a period of time that might help me, whether it be trigger point therapy, regular chiropractic care, whether it be physical therapy, anything, any of that will be helpful. So guys, it is the top of the hour again, Joe. I'm crying again because we need 2 hours, maybe three, but I don't think you want to stay there till 11 o'clock at night. Guys, you've been listening to Health Chat. I'm Dr. Nick Circolone. Give us a call here at 267-1023 every Tuesday night. You can call my office at 855-7376. Have a great week. God bless, and we'll see you next week.